Back with Your Eye on Health. Joining us now is Dr. Sudip Bose on the front page to talk about a common thing, I think, and I'm hearing it's more and more common, but I had a sinus infection and I had to get some penicillin. The doctor came in, they're like, we have the perfect thing for you, penicillin. And I said, ooh, I'm allergic to penicillin. So they had to figure out some other kind of drug to give me. Is this pretty common?
Very common. I mean, we run into that dilemma all the time in the emergency room where, patients are sick and they need an antibiotic and they think they're allergic to it. Statistically speaking, less than 10%, that's 1 out of every 10 who think they're allergic to penicillin are actually allergic to it.
Really?
Yeah,
wow.
It's very low.
So is it safe to take that medication that that is usually commonly used for those type of illnesses?
Probably.
Probably. That doesn't sound so good from a doctor. Probably. I don't like that.
So there are different forms of allergies. The life-threatening allergy is when your tongue swells, your lip swells. That can block off your airway and hamper your breathing. That's bad. But unfortunately, what happens a lot of times is your family member was allergic, so your child must be allergic. That's not necessarily true. Also, like a minor rash or minor itching, those are things that are treatable. So what I would say is if you're in the emergency room for your symptoms and you're not sure what your reaction is, the first thing is to know what is your reaction to penicillin. And if you're not sure what it is or it's minor, maybe the ER is the place where you can try it. And if you do start having something that's an adverse reaction, you're in the right spot to treat it.
They can treat you for that. And like you said, I really don't know. My parents told me, I'm allergic to it, but I never tried it since, and I don't really know what my symptoms are if I do take the penicillin. So it really is that kind of thing. But like you said, it's a great place to try. You can kind of be in that safe, controlled environment where they can help you out and you can figure out your allergy.
Right. And if you have been told by your family member you are allergic since childhood, try to ask, what was that reaction? And what happened the last time you were given penicillin? Because that can be very helpful information when you are in the situation of a bad infection.
Perfect. All right, Dr. Sudip Bose, thank you very much for joining us today.
Thank you.
All right. And we'll be doing these segments every Wednesday. If you have any questions that you may be embarrassed about, just ask your doctor, just any medical questions out there, go ahead and email me at rguadarrama@cbs7.com or just go to my Facebook page. We'll be right back.